the first time we've done an informational forum on things you should know before a crisis. And I'm very proud of the seniors that have signed up to come today, because we all are doing really well and we're staying active. But you know, information is power, and it's important that you know what resources are available before you might need them, right? Because we never know. Or you may know somebody in your neighborhood, a family member, or whatever. As we age, sometimes situations occur where we need to access other programs and services. So I'm really excited today to offer this, and we would love your feedback at the end of the program. There are some evaluations on the table that we really would appreciate you completing and turning in before you go. That way we can design future forums on information that may be relevant for you. It has been my pleasure over the last couple months to work with Mark Ash. Where's Mark? Right here to my left. Mark Ash is with Right at Home, and he brought the idea up to me about doing an informational forum for our seniors here in Prince George's County. And I believe all of you know who I am. I'm Darylyn Marinelli, the Senior Services Coordinator for the Department of Parks and Recreation right here in Prince George's County. So I thank you for coming out, and I'm going to turn it over to Mark.
Darylyn, first of all, I wanted to say thank you to Darylyn. Darylyn has such patience and passion to serve all of you in the community. I wanted to say thank you for having it for everyone here. We appreciate it. I want to make sure, my parents always taught me to say thank you first. So we appreciate being here. We appreciate all of you. It's a great turnout. Thankfully we had good weather. And I want to talk a little bit, just for a few moments. I'm going to be really brief. Want to be really poignant about why we're here. We're here to share information with you. Information, resources, programs, services that you may or may not have known were available in the community. Now, as you sit here today, no one's going to try to sell you anything. That's a beautiful thing. As you sit here today, please understand we are here sharing. And please understand that there may be more information you want to gather. And you'll have an opportunity after the event to meet with each individual vendor and or representative, and they can provide some additional information for you. But also keep in mind this. The information may not be for you today, but maybe someone that you know. We all have loved ones, family. It's really important that you understand why we're here. So really our goals today are sharing good information, eliminating inaction and victim mentality, and sharing with you resources that are available to you in the community. The panel I have before me, the first panel, the way we're going to work is we're going to have each speaker that's up on the panel is going to speak about 5 minutes. And then at the end of each session, you'll have a chance to ask questions. So there are pads on the middle of the table if you want to jot down your question as you go. That way you'll have it ready when we have the question and answer session. After the first session, we'll have another session of a different group of speakers, and then we'll have a break. After the break, we'll have 2 more sessions, and then you'll have an opportunity at the end to mill about and learn more from each individual vendor if something that they've said has sparked your attention. And I want to start really by introducing these folks. Timothy Tillman is with Caring Transitions. Bruce Goodman with Community Home Health, and they'll speak each of them a little bit more about themselves. Nancy Drexel with Washington Home and Community Hospices, and Jim Gwynn with Distinctive Home Care. And again, my name is Mark Ash with Right at Home. And I want to start with really a brief anecdote, and then I'm actually the first speaker, so you can get me out of the way quickly. I stand in front of a group like this, and I remember a number of years ago, I went to visit a friend of mine who lived out in the country. I pulled up to my friend's house, this compound, and I get out of my car and I see this old hound dog laying on his front porch. And every once in a while the hound dog would just let out this wail. Ooh! You know, usually a dog runs up to you, right? The dog runs up to you. But this dog just laid there and would let out an occasional wail. So we're inside, my friend and I, talking for a while, and every once in a while I hear that same wail. And I said to my friend, what is wrong with your dog? He said, well, he's laying on a nail. I said, he's laying on a nail? Why doesn't he get up off of the nail? My friend said, I guess it doesn't hurt him enough. So think about this in relation to why we're here today. Some of you do something called denial. It doesn't hurt you enough. And some of you know somebody who's doing that. It doesn't hurt you enough. But we're here to talk about what you can do before it hurts too much, before there's a crisis. Keep yourself young, healthy, active, and thriving in your community. Okay? So real simply, again, my name is Mark Ash with Right at Home. We do private duty in-home care. And in-home care typically comes in two types of ways. We do non-medical care. Two types of ways. One is companion care, which I'm going to speak about. And my compatriot over there, Jim Gwynn, is going to talk about CNA care. So what is companion care? What can companion care do, and how can we help you thrive in the community? A companion is an employee of a home care company. Why do I say employee? It's important that you understand that employee of a company is licensed, bonded, and insured under that company. It's important for you to have peace of mind knowing that you are safe and protected when that individual comes into your home. Okay? So that companion can come into the home. They can provide care and support such as meal preparation. How many of you know somebody that can't cook anymore, that needs help with meal preparation? Or they can help you run errands. They can help you get to the grocery store. They can help you get to the doctor's appointments that you get to. And nobody wants to miss bingo, right? And nobody wants to miss Senior Idol that's coming up. Nobody wants to miss those events that you love in the community. So you can have a companion that can assist you in getting to these types of events. Maybe you need help with light housework. You know, dusting, vacuuming, you know, wiping out the toilet that you didn't, you know, that you used to do perfectly. You're not as, you know, you don't feel like doing that anymore anyway. You want to be a senior ride on bingo anyway. So you can have someone come in and assist you in that way. Or they can assist you with just getting around in your home and keeping you safe. How many of you know somebody that falls a lot in their apartment? Or they can't get around their apartment because it's cluttered? These are the kinds of things that a companion can do in the home. Okay? Now, additionally, that companion, like I said, can assist you in going to medical appointments. That companion can assist you in basically your activities for daily living as it relates to assisting you. If you need help with mobility around your home, a companion is perfect. If you need help with reminders, some of us forget to take our medications. Some of us forget to eat sometimes, or you know somebody. That person can assist you and remind you in that way. Okay? They can assist you if you need help in the shower. They can do your back. They can help with your feet, hand you a towel. They can assist you in many different ways to keep you safe in the community. Now, other things that a home care companion can do is picking you up, transitioning you when you need assistance from coming home from the hospital. How many of you know somebody who's at the hospital, they're ready to come home, they have nobody to bring them home, nobody that can assist them in picking up their medications, picking up their groceries, and getting home safely? Companies like an in-home care company can do those things and help you transition safely into the community. So it's most important for you to understand This person is not there to get in the way of you. They're in your home to support you thriving and staying safe in your home. So many of you think about it. If you know somebody that could benefit, we're going to be in there at the end. Again, my name is Mark Ash with Rutherford Home. I'm going to introduce Jim Gwynn. Jim is going to talk about what a CNA can do in your home, and then we can answer some questions at the very end. So thank you all for listening. Here's Jim.
Good morning, everyone. Good morning. I'd like to thank Mark and thank the group for having us here today. And as Mark indicated, this is an educational forum to hopefully be able to provide you the types of information and the questions to ask of a variety of care platforms for anybody who is disabled, seniors, elderly, cannot care for themselves. Again, my name is Jim Gwynn with Distinctive Home Care. We are based out of Largo, Maryland. And as Mark indicated, I'm going to talk more about the personal care part of it. And really, personal care versus companion care is touching the body. If you or you know someone that needs help with bathing or needs help with walking or ambulating, in the industry we call it the ADLs, okay? Activities of daily living. If anyone needs assistance getting themselves cleaned up, walking, using the restroom, things of that nature, that requires a level of care called personal care. And we utilize certified nursing assistants or geriatric nursing assistants. It's a level of certification or a level of licensing of a nurse to be able to perform those duties. When you're looking at home health care, it's essentially, like Mark indicated, placing nurses in people's homes so that you can age in place, so that you can, or a friend can, stay within their home where they're comfortable, where they're secure, and not have to leave the home. Questions to ask when you're researching or when you want to find out about an agency. Number one, I'd suggest you visit their office. Make sure there is an office. Make sure an agency isn't working out of their home, for instance. Ensure that they are who they say they are. Number two, when we use the term licensed, bonded, and insured, that means something. That means the agency is licensed with the state of Maryland, Department of Mental Hygiene. Okay, that's important. That certificate should be posted in their office. We talk about insured. That means the agency is carrying workers' compensation on their nurses. Carrying a general liability insurance so that if something happens within the home, you are not liable for that. The agency is liable for that. When they use the term bonded, okay, that means if a theft were to occur, the agency can cover it up to a certain amount. That's why it is important, if you utilize home health care, those advantages that I just mentioned come with using an agency versus individual. The other thing, too, that a good agency should be able to do is provide backup care. Every once in a while, that certified nursing assistant's going to be hurt or sick or take a vacation. Agencies should be able to provide backup care. These are the sorts of things that you want to ask when you are researching a home health care agency. You want to make sure they're licensed. You want to make sure they've been in business for a good amount of time. You want to make sure that they conduct the appropriate due diligence in terms of background investigations on the people that go into a home. You want to make sure the agency is doing criminal record checks, not just local checks, but national record checks on a caregiver that comes into your home. You want to make sure there are credential checks going on. They are who they say they are. Their certifications are accurate. You want to do reference checks. All of these things, it's very important to do in advance prior to someone coming into your home through an agency or through an individual. So again, personal care is touching the body. Personal care is doing things above and beyond the companion aspect of it, which is very important. The meal preparation, the errands, the doctor's appointments. Personal care is the bathing, the assisting with walking, the cleaning, all of those things that is a different level of care. Does anybody have any questions about what I've talked about that I can assist and answer?
Jim, I'm sorry, we'll do questions at the end of
At
this
the very
session.
end. Okay. Hopefully, some of the things that I've talked about, I'm getting some of the signals here that my time is quickly running out. Hopefully, it's prompted some questions. It's given you some information. It's helped you to think about some things in this arena of care. Thank you so very much. We greatly appreciate it. Stop by the table of all the vendors that are here today. We look forward to being of service and answering any questions that we can. Thank you very much.
Thank you, Jim. Next, we have Bruce Goodman. Bruce is with Community Home Health. Community Home Health is a skilled nursing company that can come to the home and provide services. Bruce Goodman's a good friend of mine. Thanks, Bruce.
Good morning, everyone. It's great to be here, and I want to thank Mark and Lou for putting this program together, because I think it's very much needed. And as Jim and Mark spoke about, there are different types of home health services that can be accessed. There's non-medical and custodial, and there's what we do. And I'm Bruce Goodman, a Community Home Health in Maryland, and we're a full-service skilled Medicare home health agency. We do we do a one-stop shopping, which not only encompasses skilled nursing, physical therapy, occupational speech therapy, but also we do durable medical equipment, we do diabetic shoes, and we also have a division called HELP, which is a personal response system, because people want to age safely at home in place, and they want the security and the comfort of knowing that they can press a button and somebody will be there to speak with them or to get them help if they're needed. Now, the thing that differentiates skilled Medicare home health is we're one of 55 agencies, thereabouts, in Maryland that are licensed to do skilled Medicare Part A services. Our services are covered 100% under your Medicare benefit. There's no out-of-pocket or copay. But there's certain criteria that you need to meet, okay? First of all, your doctor needs to decide that you have a skilled need. And that, of course, that's going to be, you need one of the following. You need either skilled nursing services, physical therapy, or speech therapy. If you need one of those services, then you're eligible also to get occupational therapy and intermittently a home health aid if needed, which could save a little bit of resources from the out-of-pocket for a private personal care agency. But we do not take the place of those agencies, because we could come in a couple of times a week, help with bathing or dressing or something like that, but it certainly doesn't encompass what they do. You must be homebound. That's the other criteria. Homebound does not mean bedridden. Homebound means, and I did put handouts on the table, and there are some more in the back. Homebound is defined as that you're normally unable to leave the home unassisted. Being homebound means that leaving the home is a major effort. It's a taxing effort to leave the home. When you leave home, it must be to get medical care or for short, infrequent, non-medical reasons, such as to get a haircut, to attend religious services, or adult daycare. Adult daycare does not disqualify you from homebound status. The agency, of course, must be approved by the Medicare program. Now, under skilled nursing, services such as wound care, diabetic teaching, any type of disease process management and education. We do a lot of education. We come in and do that. Physical therapy, hip replacement, joint replacement, just functional problems, which also reinforces, we work very well with the non-medical home health agencies, because our ultimate goal as theirs is to keep the patient at home safely and aging in place and getting to their maximum functional level. So, and all the other services, whether it's a hospital bed or oxygen, we can incorporate and do all of that. And even, diabetic shoes, Medicare will pay 80% for heat molded, for orthotic insert shoes, and they're very stylish. We have some samples at the table, and come on over. If you have any questions, we'll be glad to help you. Thank you.
Thank you, Bruce. Now I'd like to introduce Nancy Drexel. Nancy's with Washington Home and Community Hospices. And again, for those who just arrived, there are refreshments in the room to my right over here. But if you wouldn't mind, we're going to have a break in a short while. If you wouldn't mind getting up, once we have the break, and then you'll have an opportunity to grab something. After each session, we're going to have a question and answer session. So please jot down your questions on the pads that are on the table, and then save your questions for the very end for each panel. Again, we're here to provide information for you that can help you or someone you know stay safe and keep you thriving in the community. We have a variety of different speakers, and please enjoy. Now, again, Nancy Drexel with Washington Home and Community Hospices. She's going to clear up some of those myths and misconceptions for us.
Hi, good morning. I'm going to mainly focus on the community hospices aspect. We provide hospice services for PG County, Montgomery County, and all of Washington, D.C. Hospice is a philosophy of care. It's focused on comfort versus cure. It enables people to make decisions about their own care and comfort when cure is no longer an option, or it's failing to add to the quality of their life. Aggressive treatments are just, making their quality of life not bearable. Community hospices is for people with advanced chronic and life-limiting illnesses. We pay special attention to the quality of life by making our patients as comfortable as possible. This is done by a team of professionals. The care is coordinated. Plan of care is developed for each individual patient, and that is coordinated with their doctor as well as our medical director, the nurses, home health aides, social work. We have non-denominational chaplains. We also offer bereavement counselors, and we have trained volunteers. We want to manage the physical pains, any physical pains that the patient is going through, with pain control, symptom management, and personal care. We also want to address their emotional and spiritual needs by finding meaning in one's life, assisting them in financial decisions, support in saying goodbye to loved ones. We also the hospice benefit provides durable medical equipment like hospital beds, wheelchairs, and supplies. Underpads, diapers, whatever the patient may need. Again, we offer grief support for the patient and family members and friends, and actually to the community at large, for anyone experiencing a loss. We do have trained volunteers. They all are, again, they're employees of our company. They go through quite extensive training to be able to help and assist not only the patient but the family members and friends of the patients. Basically, hospice is, again, just to summarize, our aim is to relieve any physical, emotional, and spiritual sufferings of the patients. Care is provided in the patient's home, whatever they call home. If it's an assisted living home, a home of their friend or relative, it can be provided, hospice can be provided in a assisted living and a skilled nursing facility as well. And it is covered by Medicare at 100%, medical assistance, as well as most private insurances. Thank you so much.
Thank you, Nancy. And now I'd like to introduce Timothy Tillman. Timothy is with Caring Transitions. Now, it's important to understand that physical health and remaining in your home, spiritual health and remaining in your home is important, but we're introducing Timothy in this group because he can talk about keeping your home environment safe, keeping you thriving in that environment, or maybe some of you don't have the right size home, or you need to downsize. It may be healthy for you. So that's why Timothy is in this group. Again, Timothy Tillman with Caring Transitions.
Good morning, everyone. Is this really on? Can you hear me okay?
Yes.
This reminds me of my days at the Coast Guard Academy. 5 minutes to go was a bugle call to let you know that you didn't have too much to get to. I'm Timothy Tillman with Caring Transitions. I partner with my wife Jennifer, who's over there in the next room. And we became senior move managers in August of 2005. And that was the crisis. So it's good to be here to talk about what that was like. But my wife is from New Orleans. Her parents would come up and visit us a couple times during the year. And in August of 2005, they came up to see us because they were waiting for their 12th or 13th great grandchild to come into the world, and they wanted to see that. Well, they got to Prince George's County and turned on the television and saw their house go underwater in New Orleans. So they didn't really have anything, and then they had to move. And Jennifer and I are sitting at home and saying, it's going to be very tough to help them and have a day job. And it was very difficult to go back to New Orleans, clean out a few things that were in the house, and help them to go ahead and get resettled. They had some health challenges that came along with that. They had some other challenges. They said, I don't like living with my children. So they moved into a senior community, and then he says, I don't like living with old people. So they moved out of the senior community. In the last 2 years, both of them have had some type of heart surgery. So they said, we can't live in a multi-level place. All of those things we had to move to make some adjustment to that. Caring Transitions, senior move managers, we help people move from that crisis to comfort. And we don't provide any medical care. We don't do in-home care in the way you've heard my provider colleagues speak about. But we help people to move. And that could be aging in place because you just have too much stuff in the space where you live right now. There's grandchildren, children. Somebody got a note that their kid gave them in kindergarten in a locker in the house. And it's not doing anything but taking up space, and you're going to have to move it one day. And it's going to get in your way. And if you got a walker, it's a little heavy to be able to do that. You want to start to think about those things. What are you going to do with those things so that you can be comfortable? But we help people to move. If you want to move from your place to from your 3,000 or 4,000 square foot home where your 4 or 5 children grew up and went, you're going to move into a different community that's smaller. We help you figure out what you need to take to that community so you could be at home. And that's a hard thing to do. But we'll help you to move. We'll pack, we'll unpack, we'll put things in the cabinet the way you had them at your place if you need to go ahead and be able to do that. But the biggest thing that we do is we take care of those mechanical details that you have to spend time with. We call movers, we'll call in-home caregivers, we got everybody's number in our Rolodex. We talk to each other, so when somebody has a question, we want to put you in contact with someone. But it's one call that you can make to us so that we can plan your move, you can plan the rest of your life. Caring Transitions, one call, we can do it all.
Thank you, Timothy. Does anybody have any questions from any of us on this initial panel here? Does anybody have any questions? Don't be shy. Please.
I want to ask a question. If a person can no longer walk and say they got sick, doctor recommended that she would, go to assisted living. She had to sell her home, and she's very, depressed about that. And her kids, she didn't have any kids that could help her, live with her. So I was just wondering, because I think someone mentioned that the doctor had to approve it. So I was just wondering, her situation, should she have been allowed to remain in her home, have someone come and assist her?
Can I answer?
Well, yes, let me just repeat the question real quick. Just to repeat the young lady's question, there's a woman, a person she knows who was infirm, who's now wheelchair bound, and she was told that she has to move out of her residence, her community, and she really didn't want to move out of her home. That's the long and the short of it. So the young lady asked if you need physician approval, or how do you go about helping a person stay in their home where everybody wants to stay in their home, right? So how do you help a person stay in their home? That was the question. Bruce, I think, is going to address that.
Under Medicare Part A services, to access that, one of the most important things is there needs to be potential for improvement. Okay, physical therapy can come in if, because of being immobile for a time, that somebody's non-functional, where they can be given exercises and taken to a point where they can ambulate. But more important than that is the patient needs to be safe at home. For us to have a case in the home, if there's an emergency, a fire, etc., the patient has to be able to get to safety. Otherwise, it's an unsafe discharge from wherever they were, and of course that's why they're recommending assisted living. So that's where we can work with companies like Right at Home and Distinctive to have a home health aide in there. If there's some potential for improvement, then we could certainly come in and do an evaluation, some therapy and stuff.
Right. And a company like Right at Home or Distinctive Home Care, others, can come into the home. Some of us can provide 24-hour care, which is awake care 24 hours in the home to support that person remaining in their home. Some of us can provide live-in care. And live-in care is when a person stays in that individual's home, but with live-in care, that person's not always awake. So, as Bruce said, the most important thing is safety. If an individual is safe alone and can exit in the event of an emergency on their own, they can be left alone. If not, you can have 24-hour care in the home that can support staying in the home. That is a great question. Thank you so much.
Mark, I'd like to just piggyback on that a little. Someone's going to stay in their home, and they have to be safe. There are things that can be done in the home so that someone that's moving around in a wheelchair can do that. If you rearrange your furniture, you may have to widen your doorways. You may have to get the tub that has the door on it to go ahead and get in there. There are a whole host of things that can be done so that you can age in place, but you want to be able to be in that conversation with someone to say, this is what it's going to take so you can age in place and you can be comfortable in that particular place.
Any other questions? Yes, ma'am.
All right, I would like to go under home involvement, helping people to move, and just like you spoke about helping them to arrange your home. Is that provided under Medicare?
Typically, if the question was things like in-home care and things like transitional, the transitional assistance, is it covered under Medicare? Typically not covered under Medicare. You may find some community resources. In each community it's different, but you may find some community resources which can assist you in modifying your home to keep you safe in your home. There's organizations that provide that. You may find some assistance in having or paying for a caregiver that can come into your home to provide care in the home. your long-term, if you have long-term care insurance, that may pay for having a caregiver in the home and pieces like that. And also, and one of our speakers a little bit later is going to talk about what's called the aid and attendance benefit, which if you were a spouse was in the military, you may qualify for what's called an aid and attendance benefit, which can assist you with in-home care, transitions, and at some point, home modification if necessary to keep you safe in your home. Are there any more questions for this session? Yes, young lady.
Yes, I have a question. The services that you mentioned, the care, with personal services or just the companion. My question is, I'm a PG County resident. My mother is DC. We're in the process now trying to figure out whether we're going to let her stay in her home or whether she's going to come live with us. Some of these agencies that provide the companion and the personal care, do they do it in the metropolitan area or just PG County?
That's an excellent question. Did everybody hear that? The question was, they have an individual situation, but the main question is, do all of us provide care just in PG County or around the general area? With Right at Home, for example, we cover PG County, Anne Arundel County, Montgomery County. We have a sister franchise in the DC metropolitan area. So any of us, Bruce, you cover the state of Maryland?
We cover from Charles and Calvert up to Harford County and Frederick. We do not have a license to do skilled Medicare services in the district, but we will be doing durable medical equipment in the district.
Jim?
Yes, we are licensed, bonded, and insured in both Maryland